The next section of the day is the National Development, a Social Perspective. This session is divided in two parts, a healthcare perspective and an environmental perspective. We will start with the healthcare perspective. Allow me to introduce the first speaker. She returned to her home, St. Martin, in 2003, directly after obtaining her master's degree in health sciences at the University of Maastricht in the Netherlands. Her bachelor's degree in nursing, along with her major in health promotion and education, has benefited to her success as head of the Policy Department of Public Health within the Ministry of Public Health, Social Development and Labor, in developing and implementing local projects aimed at improving the lifestyle of our population. It is my pleasure to introduce Ms. Fenna Arnell.
Good morning. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. A very broad definition, but when placing this definition in the context of national development, there seems to be a strong correlation between both. National development focuses on improving the lives of the citizens, and health is defined as a state of being more than disease-free. Gone are those days when a person was considered healthy because they were not just physically ill. To understand the relationship between health and national development, let's try to take a look at the social determinants of health. For my presentation today, I chose to use the framework which is used by the University of Wisconsin Public Health Institute. My choice for this framework is because it has broken down the core determinants of health into values. This framework indicates that 80% of the population's health is contributed to non-direct related health care. Mind you, this does not mean that access to quality health care is not important. It simply verifies that a population's health is for the most part influenced by the social economic factors, personal behaviors, and the quality of the environment in which they work, live, and socialize. Those factors include access to education, employment possibilities, having a livable income, safe communities, availability of safe communities, equity in our society, individual behaviors such as substance use, nutrition, and physical activity. The discussion on national development and its correlation with health has been ongoing for decades. The key factors usually included in National Development Plan, as described this morning, is the economy, social, infrastructure, and of course, healthcare. Economy of our population impacts the productivity of the labor force in multiple ways. In cases where individuals are too ill to work or are forced to remain at home because they have to provide for a sick family member, productivity at that time is zero. In events when a person is ill but can work, productivity is lower. So, in other words, sick is synonymous to less productivity. Continuous increasing cost associated to improving the quality of healthcare, notwithstanding the global reality of shortage of resources in healthcare, also has an influence on the economy. Our social makeup, health coverage. When the healthcare package does not focus or does not include services needed to prevent the onset of illnesses or to prevent worsening of illnesses, this becomes a financial burden for the family and then by the community. When we focus on our vulnerable groups, Our policies, are they aimed at securing equity in our community? Do they focus on the elderly? Do they focus on the mentally and physically challenged? Our infrastructure, how is access to affordable homes? How can we secure that the neighborhoods are safe? How can we secure that the neighborhoods support social and physical activity? Healthcare, access to quality health facilities and providers. How can we secure that those facilities that are needed are available on the island and affordable medication is available when needed? All of these factors and more define how developed your country really is. So how can we secure national development and simultaneously improve healthcare? The model on this screen, the planning cycle, makes collaborative planning seem so easy, but it's the most difficult to apply when working in teams and when working in multiple sectors. The main steps in planning constantly return. Review your data, assess existing programs, identify areas that must be addressed, define a plan for change, implement the change, and then the process starts over. But we need to begin the process of collecting necessary data. We need to begin the process of proper planning and defining clear indicators. And we must do this together. As my daughter always tells me, Ma, teamwork makes the dream work, and it's so true. A few local examples. Considering the fact that our nation's main source of income is tourism, our market's foundation should be built on the premise of constant movement of people and goods. Annually, there's a transition of a little more above 1 million people on this beautiful rock we call home. We have successfully invested and secured a state-of-the-art airport and cruise facility. We have traditionally focused on modern development techniques in the tourism sector as a means to secure the needed income to safeguard the livelihood of the citizens of St. Martin. Beautiful. But this has its pros and cons. The flip of these investments is the fact that the consequences were not fully thought through, and therefore, in some cases, insufficient preventive measures were put into place. One example would be the emerging of new infectious diseases. Over the past recent years, we have experienced vector-borne illnesses that were previously not on the island, chikungunya, Zika, and reports indicate that the first cases were all imported illnesses, so not endemic cases. Another example would be the beautification aspect. We have invested in beautifying our main streets. However, little consideration was given to the vulnerable groups of our community. The sidewalks are not wheelchair-friendly. Persons with pulmonary issues may encounter difficulties with inhaling the fumes of the landfill, but I leave that for my colleague. To answer this question, I am strongly of the opinion that we first have to be cognizant of the fact that health is important for development, and development is important for health. Conditions in which people live, work, and socialize clearly has an impact on their health and well-being, and a healthy community is a great contribution to the development of the country. How has national development influenced healthcare on St. Martin? Using the most recent major development as a timeline, the change in our constitutional status, these areas on the screen has been influenced immensely and quite fast. We can now say we have an inspectorate of health physically available on St. Martin, which means we are capable of analyzing and determining our quality of health if it's available and where we need to improve. We now have a responsibility to develop our own legislation and policy in order to farm and improve our healthcare system. We have increased availability in intramural care. We now have our own mental health institution, which caters to the care for clients that were previously treated in Curacao. Prior to 2010, that was not possible. We have recently started providing revalidation care at the White and Yellow Cross. We have strengthened cooperation with French St. Martin, whereby cross-border collaboration has increased. And we have recently strengthened our structured collaboration with the American University of the Caribbean. I chose to focus on the positives of that change in our development. So in conclusion, there's a popular saying that goes, there's no wealth without health. And I sometimes jokingly say, there's no health without wealth. And why do I say this? Just to name a few items a person needs in order for them to be considered healthy based on the WHO standards. Adequate home with all necessary amenities, running clean water, proper electricity, proper IT system, a job with a decent income, access to education, also a price tag, access to affordable, nutritious food, sufficient physical activity, access to affordable health care, social support for child and family care, and the list goes on and on. And every one of these items, besides probably physical activity, comes along with a price tag, be it for the individual directly or the community at large through government funds. In conclusion, to secure national development, we must understand and accept the fact that there is a general correlation between the wealth of a country and its level of health. The National Development Plan must at all times include social, economic, and environmental factors. Proper use of the various planning cycles should be used when developing, implementing, and evaluating the country's development plan. Improving the standards of health should be one of the primary aims of any development program because good health strengthens development, increases productivity, and strengthens people's capabilities to continue developing the country. Thank you.